We've been partnering with Ozark Orthopaedics. The team is specializing in making sure you get back on your feet after an injury.
That's right, and today we're meeting with Dr. Henley, who specializes in pain relief for carpal tunnel injuries. Let's go.
So we're inside and we're meeting with Dr. Noel Henley. Thank you so much for having us.
Thank you.
So as we've been working from home, or as we're sitting at our desk, or even maybe even watching TV, carpal tunnel is something that is very common. I've actually had it myself. Talk to us about what it is and what are some symptoms?
Sure. So a lot of people think that any kind of wrist pain would be carpal tunnel, but that's not true. You can have lots of things that cause wrist pain, tendonitis, an injury, of course, but carpal tunnel is one of those things. So carpal tunnel syndrome is numbness and tingling in the hand, usually worse at night, sometimes waking people up from a dead sleep. It can happen at any age. The reason the numbness happens is because there's a lack of blood flow in the nerve. And so carpal tunnel is literally a tunnel in the wrist, so it's right here. And in that tunnel, there are 9 tendons and 1 nerve. So the swelling happens in the tendon linings. They swell up and they push on the nerve that's inside there and choke its blood flow. And so to keep those fingers and flexor tendons moving and keep them loosened up is a good idea.
I'm Rocky Fleming. I'm the founding director of Influencers Global Ministries. I'm a writer, a lecturer, a mentor. I started having symptoms of the carpal tunnel about 2 years before I had anything done about it. I was having numbness. I was being waked up at night because I couldn't sleep. I'd have to get up and shake my hand down. Little things that I normally did with ease, like using a screwdriver or writing in my journal or typing on the keyboard, they were greatly limited. And as a result, I found myself struggling. After I started investigating, I found that Dr. Henley was a hand surgeon, and I went to him. And in that evaluation, he was very professional and shared with me what he thought that I had, but I'd need to have nerve tests to verify that, which I did have a nerve test on that. And the nerve test indicated that I did have carpal tunnel. It's obvious that they try to do things before they do surgery, and one of those that he did was to do the injection. And the injection helped a little bit, but it really didn't take care of it. And finally, I felt like that the only way to deal with this was to go ahead and have the surgery. I was given a very light dose of anesthesia that put me in a little sleepy time. And just a few minutes later, I was told, hey, it's done. The recovery on that was also, I think, very encouraging. I didn't really have any of the painful symptoms anymore, but I had some immediate relief from it. I didn't have the numbness anymore, and through the weeks, my wrist began to get stronger and stronger and stronger. It's nothing to fear, I don't think, and it's something that will help you greatly.
So let's say you get to the point where you realize that you are going to need to have that surgery.
Mm-hmm.
Surgery is a scary word for me, probably for a lot of people. Mm-hmm. Can you kind of walk us through what that process is like?
Yeah, sure. It's generally a surgery that's done with you mostly awake, which sounds scary, but they give you some sedative and make you sleepy for about 4 minutes, and then I put in some numbing medicine. And so in the actual operation itself, you're kind of half awake. There's a drape up, of course, you don't see anything. But that way, you're waking up faster. There's not a tube in your throat most of the time. The surgery takes about 7 minutes once the skin is opened up. And once the surgery is over, you're in a soft bandage and you're moving it right away, even in the recovery room, moving your fingers. But usually that recovery time works in 2 phases. The nighttime stuff, the nighttime waking up and the pain, that gets better really fast, sometimes that night. And then the leftover tingling during the day or with activities, that can take several months, even up to a year or so for that to completely go away, depending on age of the patient and severity and things like that. So the surgery itself is not a big one, but it's still a surgery, so we still have to have a conversation about pros and cons and risks and things like that.
Dr. Henley, thank you so much for having us today. Definitely want to make sure we're just doing a couple of little stretches like you said.
I know, because I know I'm typing a lot these days, so stretching it out, that's great.
Absolutely. Thank you so much for having us, Dr. Henley.
Yeah, thank you.
We'll be right back with more Good Day in WA. Do those stretches.